welcome to my channel. In this video I'm going to talk about leucorrhea. Leucorrhea is one of the disease which most of the patient think that it's not need a treatment or it's just common kind of thing like that. Some people does not know what is leucorrhea. First of all, I'll be making it clear that is a white discharge in the females. This white discharge is a normal thing, of course, I agree on that, but increased discharge is an very problematic, and in an non-menarche people means the girls who are not into the menses but they are getting leucorrhea, then you should also have a look at it. And when the discharge is so much watery and it's so kind of acidic and it's leading to itching or any kind of skin rashes, or it's troubling you, then you need a treatment. Of course, urine is also a common thing, but it has its own difference, right? The same way the leucorrhea is also. This video is for only for girls. So let's talk about leucorrhea in today's topic. Myself, Dr. Mika from Homeopathic Clinic. I'm a practitioner of homeopathy from 5 years. First one is acid phos. Leucorrhea in nursing women who nurse the child longer than an year. The time you can think of means the nursing woman means the woman who is feeding her child. Okay, that is nursing woman. The woman who gives her milk for the child more than a year, because as a doctors we advise that 1 year is sufficient. After 1 year the baby will be taking the external things and it will be sufficient for the baby to grow, so there is no need of feeding. But if you're kind of okay in the feeding thing, you can just feed it also. But that type of women also suffer with calcium deficiency, iron deficiency, vitamin 12 deficiency, and there are so much of things because she is not taking a proper food and the baby is growing and the baby wants more milk. It's not like it's still a small one and it only takes a small amount of milk like that. So the patient will be so much into the deficiency. That time the patient is having, means the woman is having this leucorrhea, then you can give acid phos. And you can also see that how the leucorrhea is. The leucorrhea will be yellowish and there will be so much of itching in the parts. Okay, at that time also you can think of, but in the nursing woman you can think of acid phos. If you ask for how you can prescribe it, you can prescribe it in the pills form also, because the baby is also taking the milk and the medicine will be also given to the baby through the milk in a smaller amount. So better give it in a lower potency and in the lower form, that is 6 ch or 30 ch once a day like that. Or just ask the patient to stop nursing the child and you can also give her the potency which is needed. Okay, the proper guidance should be given. Okay, next one is alumina. Alumina is mainly for the leucorrhea. Alumina discharges are always transparent, means the discharge, white discharge, you can see clearly that it's so much jelly and it's so transparent, profuse, ropey and also acrid, and it runs down to the legs and the feet. Burning leucorrhea worst during the daytime. This is also one of the common form. Next one is borax. Leucorrhea like white of an egg with sensation as if warm water was flowing. This is one of the common symptom of borax, that the leucorrhea looks like, means white of an egg. It's so thick. It's not transparent. It's so thick and you can know that that type of whiteness is there. And also the patient says that it's running down, and she feels so much uncomfortable because of the water is flowing away like that. Leucorrhea and with the backache is also kind of common. Even in the pregnant women, you can think of leucorrhea and backache. Whenever the patient gets this kind of leucorrhea, they also complains of backache. That time also you can think of borax. Sensation as if spine is broken and tied together. This is one of the sensation which the patient gives. I had seen 2 to 3 patient has given me this kind of sensation that first my backache starts as if my spine is being broken, because I had not experienced this type of pain. But after few minutes or few hours, the leucorrhea starts. They say that. That is one of the peculiarity. Okay. Next one is, you can think of, is creosotum. Creosotum is one of my favorite because whenever someone comes with leucorrhea and I feel like it's just an acute leucorrhea, I just give the creosote. If it is chronic or if it is disease related, it's okay. But if it's just an acute leucorrhea, then just give the creosote. Creosote is a wonderful kind of thing. It's going to take out all the things. The creosote is given when there is leucorrhea yellow, leucorrhea smelling like green corn, and worst between the periods. During the periods also the leucorrhea happens, or before the periods or after the periods the white discharge happens more. That time also you can think of creosote. Next one is phosphorus. Discharge is very profuse. Profuse means the patient changes 4 to 5 panties in a day. That type of profuseness will be there whenever you are prescribing the phosphorus medicine. Smartening and corrosive. Leucorrhea instead of menses. Pulsatilla. Leucorrhea acrid, burning and creamy. Also in the children. Cephalinum. Leucorrhea profuse, thin, watery, acrid with sharp knife-like pains in ovaries. The discharge is so profuse that it runs down to the feet. Very useful for those having an history of syphilis in the family. You can also think of hydritis. Leucorrhea worst after menses, acrid, and also you can also think when there is discharge is so thick and yellowish. And better go with the creosote, or go with alumina, or go with the borax. These 3 are the key symptoms for the leucorrhea. There are other remedies also like acid flow. So there are so many remedies, but these 3 remedies are the one which we regularly give and which we had seen so much of result in leucorrhea. So don't neglect if you are suffering with any kind of leucorrhea which is troubling you. If it is not troubling you, it's okay. But if it is troubling you, then you need an consultation and the treatment. So better look into that, because if you are not treating your leucorrhea and you are just leading it like that, there are so much of infection, UTI or other complication which you are leading to the further diseases. So don't let that happen. Please do take a step forward if you are suffering. Thank you so much. Please do like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. If you have any kind of diseases which you want to know about homeopathic treatment, please do comment on the comment section. Thank you so much. Have a good day and a fantastic life.